So my name is Duncan JODRELL. I'm the Professor of Cancer Therapeutics at the University of Cambridge. I'm a trained medical oncologist, so I see patients with cancer. I run early phase clinical trials, but I've also run a laboratory running preclinical pharmacology studies, which has informed my clinical practice. Translational research to me is close interactions between laboratory scientists and clinicians. It is both direction from the bench to the bedside, but also observations that we make in the clinic, we feed back into our laboratory work. So it's an iterative process and hopefully therefore leads to improvements in the future, which we can translate into patients and improve outcomes once they've been diagnosed. So I think in the last few years there have been two major advances from my perspective. One is the use of precision approaches, so trying to identify the correct drug for the correct patient or the right treatment for the right patient. And the other has been the emergence of immunotherapy and stimulating the body's immune system to target cancer, and in many cases with excellent responses. Both of those are limited to a small number of tumours, and I think in our research we need to make sure that we broaden the remit of those approaches to improve outcomes. The other area that is clearly important is that we detect and intercept disease at an earlier stage. Preferably that would be before the cancer has started, looking at pre-malignant lesions. But obviously early detection of small cancers before they have an opportunity to spread is another frontier that we need to cross. So when I started in my career in research, I was struck by the fact that cancer was an area where advances had not been made particularly, and this was a number of years ago. Obviously, those advances are now being made, and it's been very exciting to be part of some of those. But there are still many more challenges ahead of us, and we need to do better for our patients. And I think that is very important. It's a very exciting area to work in. It's very dynamic, and we are still moving forward. So the difficulties that we have with pancreatic cancer are that it presents late. Often with symptoms that are not particularly specific, and therefore the disease is overlooked. And by the time it is detected, it is already advanced, either locally in the pancreas so that the disease is not operable, or it has spread elsewhere in the body. Less than 20% of patients who present will be suitable for an operation, and even so the majority of those will unfortunately relapse with metastatic disease. The other difficulty we have is that it is a disease that is associated with older people, but also many debilitating symptoms associated with the disease, which make it difficult for them to tolerate the combination chemotherapy regimens that we have developed. And that's one of the reasons why there needs to be more focus on early detection and early disease, so that we're not dealing with people who are unwell with extensive disease. We catch their tumour or the pre-malignant lesion early, and we intercept and stop that developing further. So I was delighted to be invited to this 50th anniversary of the Cancer Centre, and I've heard some fantastic talks. I came as a keynote speaker. I hope that I've provided some insight in the work that I've been doing, which is actually very similar to a lot of the projects which are ongoing here. And I've been very impressed by the quality of the science presentations that I've heard.